All right, and we've all done this. Application of a therapy that fails to eliminate the discriminator will ultimately fail that patient. Okay, so if I, as a surgeon, go and fuse a disc that looks unhealthy on an MRI scan, or if I put an artificial disc into the lumbar spine, and that's not the cause of their back pain, then that procedure will fail. If I apply some corticosteroids to a joint that looks a little bit inflamed on an MRI scan, or by examining a patient, it may give you temporary relief, but the pain will come back again because I haven't eliminated the discriminator. Okay. Pain specialists will give you pain tablets. Okay. All the different types of pain tablets out there, but that doesn't eliminate the discriminator. That doesn't actually take away what caused the pain in the first place. It's just coming in at the back end and saying, okay, you've got pain, here's a pain tablet, so therefore take these tablets and you'll be fine. It doesn't, it will ultimately fail. You might feel good for a couple of days or a week or 2 weeks, but ultimately that pain tablet will start to lose its effect because you haven't got rid of what is actually driving the problem in the first place. Does that sort of make sense? And the same with core strength. Doing all the core strengthening in the world won't take away back pain because we know that not having super ripped abs is not the cause of back pain. The manual therapy, the magic hands treatment that everyone gets for their tightness does not take away the cause of back pain. All right, I've got a special slide here just dedicated to degeneration. We know that people can be elderly and have heaps of degeneration, okay, like that, heaps of degeneration. And degeneration just means just the natural aging, wear and tear on the spinal integrity. Just like this is degeneration of the skin. It's normal. If we can accept that that's normal, then we can accept that degeneration of the spine is normal too. It's not a magical structure that doesn't degenerate. All parts of our body degenerate. Our eyes, our hearing, our skin, our discs, our joints, they all degenerate. There's no special part of our body. And we know that people can degenerate and have absolutely no back pain. Okay? And we know that people can be young and have a perfectly normal scan. So I saw 3 people today with perfectly normal scans that were suffering back pain. So it does not make sense to say that degeneration is the cause of back pain. Degeneration is not the discriminator. There is something else that is driving the pain symptoms. There's something else that's driving that. And we can say that there is a biomechanical reason that we will create mechanical stress on our spinal structures, and that biomechanical stress transforms into biological inflammation. Biological inflammation manifests with pain symptoms. Okay? So what we want to do is we want to reduce the likelihood of you developing biological inflammation in your tissues. So you can have a degenerate spine with no inflammation and be pain-free. You can have a very young, normal-looking spine with lots of biomechanical stress and lots of inflammation and be suffering chronic pain symptoms. Okay? And if we think about movement as being the driving force for mechanical stress, we can see that you can move like this, which is very proficient, or you can move like this, which is dysfunctional, and now you start to put the puzzle pieces together to work out what the actual cause is that drives your pain symptoms. Okay? So degeneration is a little bit like having high fire danger prairies or bushland. Okay? There's no problem with having degeneration. It's normal. But if you subject degeneration to the discriminator that makes it inflamed, like dropping a spark, now you've got a problem. Okay? Mark has degeneration, I have degeneration, Luke has degeneration, we all have degeneration. The difference between someone who suffers chronic pain is whether that person, that individual, has dropped a metaphorical spark on their degeneration. Okay? Does that sort of make sense? You'll understand a little bit more. So that's what we all have, degeneration. Some people have that. Okay? I personally don't want to have inflammation in my back, and so therefore I do everything I can to avoid that spark being dropped in my back. Okay? It's a simple concept, but just have a think about that when you're at home and talking to family and friends about what is causing your back pain symptoms. So this is a World Health Organization statement in February of this year, 2018. And we're understanding that back pain is one of the leading causes of disability on the planet. One of the leading causes of disability on the planet. And we don't really hear too much about it. We hear about cancer and we hear about diabetes and we hear about all these heart attacks. But in actual fact, the thing that causes more suffering than any other condition on the planet is back pain. And so what does it tell us? It tells us that we're really not doing a very good job of it. We're really not doing a very good job of managing the condition. And what does that represent? If we're not doing a very good job of managing the condition, there is a lot of poor rehabilitation that's occurring out there. And if we look at some statistics, we have in Australia today, this is a conservative estimate, about 1.5 million people with back pain today. Chronic back pain, meaning that their pain has been present for more than 3 months continuously. 1.5 million people. And those 1.5 million people have not had any form of surgery. They are just going around the traps trying to sort their problem out by seeing various different people in the community, and you know who they are. They're Pilates studios, physiotherapists, massage therapists, you name it. GPs, specialists, me, Dr. Craig. And that's how many people that are trying to sort their back pain out. And that represents, in my mind, a significant failure of the industry to sort out the condition. Otherwise, it wouldn't become a global epidemic. Okay? It's a global epidemic. And that then tells me that the vast majority of the industry is not understanding the discriminator. They are not understanding how to teach you guys to prevent those sparks falling on your normal degeneration. And so therefore, there's lots and lots of people walking around with inflammation in their back and therefore pain symptoms and therefore disability. Okay? Is that starting to draw the strings together?